Embracing a socialist agenda, progressive Democrats are vowing to give some form of free single-payer health care at the state level, including Democrat Abdul El-Sayed, who is running in tonight's Michigan primary. Here now, James Freeman, Wall Street Journal editorial page editor. He's also a Fox News contributor and the author of the brand new fantastic book, Borrowed Time, that you brought with us. I mean,
yes.
What do you think of this push, Medicaid for all? They couch it in moral terms. I mean, if you are a good person, you're obviously in favor of this, and if you're evil, you're against it.
Yeah, this is one more test tonight of how many Democrats want to march over this cliff with Bernie Sanders, who is, as far as I know, not actually become a Democrat.
Yeah.
But he's offering the full socialized medicine. And we should point out that when they say Medicare for all, they actually destroy Medicare along with every other form of insurance. So this is changing medicine for every single person in America. It is a radical step. There's no way to afford it. Patient care will decline. But here we have a swing state.
For our viewers out there, why would their insurance that they have right now not be available if we went to Medicaid for all?
Well, I suppose we would ask Bernie, but in his legislation, he specifically gets rid of other forms of insurance. Now, I think that's probably because socialism never works when it's voluntary, right? You need to force everyone into the system so that the government can ration care. We're seeing these sort of weekly or monthly horror stories coming out of the UK where they've had socialized medicine for decades now. And I think it's interesting in Michigan, swing state, if the party there as well is going to go for a gubernatorial candidate that's this radical.
Yeah, I mean, it's hard to quantify what we're talking about here in terms of price, but under some estimates that I've seen, you would have to double every individual, every viewer, your taxes would be doubled, and every business, your taxes would be doubled, and it still wouldn't pay for Medicare for all.
Well, you look at the experience of other countries, and I think the UK is a good example. You know, when we talk about the horror that's Venezuela, people will say, oh, well, no, we're going to keep our society cool, but just the medical part is going to be socialized. But the UK, what you get is long lines, you get rationing, you get people who can't get the treatments they need when they need them. So I think this is
and then you get
amazing.
Rich people buying what they really need somewhere else, right?
Yes.
Yeah.
Well, I think that's what people hope, but there's no guarantee that escape hatch is there.
Yeah. Your book talks about another industry where government help is not so helpful. I mean, you basically explain for anyone out there who wants to understand or be able to reiterate the argument about how government regulation doesn't make banks better. You kind of make it in there.
Yeah, well, this is kind of for anyone who was appalled at the 2008 bailouts. We look really at the history of Citigroup, and we find that over its first century, when it was basically a free market bank, it wasn't supported by the government. It was very healthy, very stable most of the time, whereas in the century that it's been backed by the government, one problem after another culminating in 2008.
Yeah, it really helps you understand the problem overall and stokes the outrage and gives a little Elizabeth Warren something to chew on, possibly.
Well, it really rebuts her argument, and we have a new document in here we were able to pry out of the FDIC with a FOIA request that shows the problems were in the regulated bank.
Yeah,
in large part.